or in the thick of a problem, you're sure to gain something from our interview today. So without further delay, here's Noel with today's guest and a ton of solid, practical relationship advice.
Welcome to Oxygen 365. I'm your host, Noel Metter, and this is episode number 30. Today's guest is Dr. Heather Gingrich. Dr. Gingrich is a counselor, scholar, teacher, and former missionary. She's a professor of counseling at Denver Seminary and maintains a small private practice working with complex trauma survivors. Dr. Gingrich wrote the book, Restoring the Shattered Self, which is our focus today. She's been married to her husband, Fred, for over 30 years and has 2 young adult sons, and they're raising their 15-month-old grandson. Dr. Gingrich, welcome to the show.
Thank you. Good to be here.
It's so good to have an expert that deals with the topic we're going to be covering today, which is really focused on complex trauma and specifically for those who are caregivers. And I think this is such an important discussion that we need to have. And there's not a lot of, I would say, experts that really can speak into this space. So I'm glad to have you on the show. And I think I'll just start with this is, what are the biggest struggles for those who are trying to help survivors of trauma?
Well, I think often those that are trying to help don't understand what they're seeing. They may be with their loved one and life is going on as usual, and then all of a sudden kind of chaos erupts. That can often happen when their loved one is having flashbacks, for example, or conversely, they may really kind of withdraw and go into a numb zone, and they're trying to figure out what happened to the person I know. So there can be some pretty drastic personality changes. If someone is re-experiencing some of their trauma, that can be difficult.
Yeah. And so maybe it would be helpful to start with, for our listeners, how do you classify trauma? Because I think all of us kind of in some way can identify with a traumatic event that's happened in our lives, but is there a separation between the two, or is everyone walking around with trauma?
Well, I don't think everyone is walking around with trauma, fortunately.
Okay.
But I think a lot of us do have some significant areas of trauma in our life. But how that's going to impact someone depends on both the severity of the trauma, how chronic it is or not, whether it was ongoing over years or whether there was one incident, and the age at which the trauma happened. So for example, if there is, say, someone in combat who has had a relatively trauma-free existence up to that point in time, and they experience trauma, while they're overseas or in combat, that's going to be a very different scenario than someone who was abused, every day for 18 years of their life starting at age 1 or before. And the treatment approaches in terms of the counseling end of things are really quite different when it comes to both of those scenarios. And then you have everything in between.
Right.
Of course.
Right. So let's just walk through those two scenarios, because I think for our listeners, those are probably the more common things that we hear about, especially our listeners within the military. We do a lot with caregivers. Do caregiver conferences with the USO, and many of them are dealing with invisible or visible wounds, and often it's related to something that's happened downrange. So maybe start there, but I also want to cover the other topic, which is the childhood and whether abuse happened, physical abuse at a very young age. You talk about there's different ways to address that from a therapeutic standpoint. Maybe we could walk through both those, if that's okay.
Sure. Well, let's talk first about someone who has had a relatively trauma-free existence, maybe no child abuse of any significance, and then they experience some kind of trauma as an adult. So whether that's a military vet in combat that experiences something traumatic, or whether that's say a woman being raped as an adult who hasn't had really a trauma history before that. One of the big differences is that as an adult, we already kind of have our personalities formed. If we haven't had a lot of trauma, then we have a pretty solid foundation in terms of identity, who we are, our sense of self, self-esteem, how we see the world, and so on. And a traumatic event, when it comes to someone who is, relatively healthy to begin with,
Mm-hmm.
will still be traumatic. Someone can still have flashbacks, it can still impact them. But if they have that solid foundation, chances are that if they get the proper help, they can be healed relatively quickly, relatively easily. I mean, nothing's easy about trauma.
Right.
But compare that to someone who has experienced, especially abuse or any kind of trauma, really, when they're really young, before they have the capacity to understand what's happening to them, while their identity is still being formed. Look at children and how spontaneous, how innocent they are.
Mm-hmm.
And if someone sexually abuses them or physically abuses them or even, emotionally is abusing them continually, then that impacts the very foundation of their sense of self and how they see the world and how they see relationships. And then if you actually pair that person with someone who goes into the military and goes into a combat situation, then you have a really potentially very negative situation. In fact, research has shown that veterans are more likely to experience PTSD if they also have a history of child abuse.
Okay. Okay. So for each of those situations, how do they restore the shattered self, as you would state in your book? And maybe this is walking us through the 3 different phases that you discussed. But what does that look like for
Sure.
the adult who goes through trauma and the child who's growing up and that the identity hasn't formed?
Right. One of the big differences is for the person who's experienced kind of either single incident trauma or especially if they've experienced trauma as an adult, is that cognitive behavioral approaches in terms of counseling approaches are the ones that are typically used. So that you may be, your listeners, not readers, may be familiar with the idea of exposure therapy. And the idea behind exposure therapy is that someone talks about what has happened, and as they tell their story and maybe tell it in different ways at different times, that it almost kind of desensitizes the individual to the impact of the trauma. And after a while, it just doesn't have the same impact anymore. That's kind of the basic principle behind those approaches.
Okay.
Someone who has experienced trauma as a child, and especially if it's more chronic and their whole sense of self and identity in the world and relationships has been impacted, that involves a much more kind of extensive approach. It means really taking a look at both the traumatic events as well as the impact of those events on the developing self.
Mm-hmm.
So someone's whole sense of who they are and how they relate to the world often really shifts as people receive healing.
Mm-hmm.
Now, in terms of my book and the kind of the 3 phases of treatment, my book is specifically on complex trauma, but I think those phases also apply to single incident trauma or trauma as an adult. And that is, the first phase is safety.
Let me just, I just want to make sure that our listeners are clear on this. So when you say complex trauma versus just typical trauma or PTSD, what is the difference?
Okay,
Is it single incidents, like you say, single incidents versus multiple? Is that the difference?
That's one thing. Complex trauma tends to be more chronic,
Okay.
ongoing, but also complex trauma tends to be more relational in its focus.
Okay.
So that's where child abuse comes in, but someone can also be a complex trauma survivor as an adult who doesn't have a child abuse history. If it's relational, for example, someone in a domestic violence situation, even if they go into, say, a marriage or, a romantic, intimate relationship with a good foundation of the sense of self, if someone is constantly being battered either emotionally or physically, that can erode that good foundation pretty quickly. Mm-hmm. So even that person can become a complex trauma survivor. Or in the case of someone who has been kidnapped or who has been a torture victim, if the torturer is the enemy, then often that may lead to PTSD, but not necessarily to complex trauma. Mm. But if the person that is the torturer or the kidnapper is someone that's known to them, someone who's supposed to be safe, then the relational aspects of kind of the betrayal aspects of the trauma, this is someone who's supposed to take care of me.
Right.
For example, sexual trauma in the military, say there's, I know both men and women experience sexual trauma, but if either a man or woman is abused by someone in a position of trust or authority, then that's going to have a different impact, or even a comrade,
Right.
that there's a sense of betrayal there in the relationship that's different than some stranger
Yeah. Well,
raping someone.
thank you for clarifying, because I know that was maybe confusing for some of us. So walk us through the three phases in your book of treatment.
Okay, the first one is safety and symptom stabilization. And this is actually a phase that got ignored a couple of decades ago, early on in kind of the treatment, especially of complex trauma or survivors of sexual abuse, for example. The idea was, you go straight into the memories of the trauma and you process the memories. And if you kind of talk about the memories, the exposure therapy idea that
Right.
maybe the more you talk about it, the less impact it will have. The problem is that what they found is that sometimes re-traumatized people. People that were actually functioning okay, maybe not really well, but they were still able to work and still able to parent, all of a sudden, sometimes couldn't function at all and would have to be hospitalized. So they started to take a look at, okay, what's wrong with this picture here? And because treatment for complex trauma, especially that's been chronic, that's maybe lasted over many years, it's a longer term process. We're not just talking about a couple of sessions, a few weeks or a few months. We're generally talking about years. It's not just a matter of kind of hanging on by your fingernails
White
until
knuckling it.
right, because that used to be kind of the thought, kind of white knuckle it. You get to the end of the horror, and you'll be better. So it's
Right.
worth it.
Yeah.
But meanwhile, people's lives were being destroyed. So we now put a lot of sense of on the safety and initially kind of stabilizing some of those symptoms before talking about the trauma at all. And even PTSD, more single incident adult trauma, while they don't talk about the phases in the same way, it's still important. I mean, if you're going to work through your trauma, you have to have a sense that the person you're talking with or that's going to help you through it is trustworthy, that someone is going to keep your confidence, that you can know where this is going to go, that there won't be a black mark on your record, that you can make yourself really, really vulnerable and know that it's okay, and that you're not going to get out of a counseling session and go home and have worse flashbacks or not know how to deal with them.
Okay. So that's phase one.
That's phase one.
Yeah.
Phase two is the actual trauma processing, which is going through the trauma incidents, talking about them in detail. For some reason, the details are really important. I didn't used to know that. I used to think, people kind of talk in generalities, it kind of protects them more, but it doesn't do the trick. And we don't know exactly why, but for some reason, the details are important. So kind of walking through a trauma narrative step by step, piece by piece, not just in terms of talking about what happened, but also getting in touch with the emotions involved. How did that feel? As well as what were the physical sensations of that? How was the body, responding to that? All of those components seem to be important. Just kind of talking about something cognitively doesn't quite do the trick.
Okay. Okay. All right.
Which people aren't happy about.
So let me ask this question. Is processing the trauma always done through talking? Is that the only way you can process the trauma, or is there other modalities that allow us to get through the processing without having to talk about it?
If for children don't have to talk. They can play it out. They can kind of reenact their trauma through their play and receive healing in that way.
Okay.
But adults seem to need to talk. Now, there are body therapies because trauma does impact the body, and there are times that there can be, through physical movement, through changing body posture, that can release some of the tension and around some of the memories, and it can even bring some up, but it still needs to be talked about eventually. There is a process called EMDR,
Right.
which still involves talking,
Yes.
but it can be a bit of a shortcut in some aspects for kind of more traditional PTSD.
Uh-huh.
With more complex trauma, sometimes it can be helpful, sometimes it can be a little risky.
No, and the way I've had this explained to me, and by no means am I the expert in this, so I want to see if you agree with this, but, trauma, typical trauma, we are able to process that in our REM sleep cycle, where it's during that time that, and this is trauma that, man, I stubbed my toe, or, this is the normal day-to-day kind of stuff, but...
More stresses.
Yeah, stress indicators. But the more significant trauma, like PTSD, it's been explained to me, it's almost like a ball that gets starts to grow, and we can't process that in the REM cycle of sleep, and so it begins just to pile on itself, growing. And so as I've heard that the MDR or EMDR, that rapid eye movement, helps to begin to break down that trauma. Is that accurate? I mean, I'm just curious to know if that's part of this processing of the trauma.
I don't know about EMDR specifically addressing that. That's one trauma processing tool kind of thing. But it's a complex question.
Yeah, I know.
With not an easy answer, but one of the aspects of the answer is that even in terms of the brain, different aspects of the brain process trauma or store trauma compared to kind of our regular daily kinds of difficult events. And so that makes it different. The other thing that can make it different is that trauma memories can be blocked. People can have amnesia for their trauma. Mm-hmm. And so that's why it's not unusual for someone to have kind of delayed onset, say, of PTSD symptoms, is that years can go by and someone can think that they're just fine, and then all of a sudden they start to have symptoms.
Okay.
So that can also make a difference, that we're not just kind of going to automatically process that during REM sleep. What sometimes can happen is that trauma memories kind of come back as nightmares. So rather than as waking flashbacks, there can be nightmares that are like nighttime flashbacks that can happen.
Yeah.
But they're the regular day-to-day stuff. Our systems are built to kind of handle that. But these are things that we're not really built to just kind of normally handle.
So the processing is really to begin to open up and peel back the layers on the trauma to fully understand what's going on there and help. What before we move into the final phase, I just want to make sure that you've given enough background on the processing. What's going on there?
Well, part of it is, well, again, those are difficult questions. One of the ways that I look at it that I find very helpful is kind of looking at reintegrating aspects of our experience, because very often when there's a traumatic event, aspects of our experience become dissociated, is a technical word, or become compartmentalized. So, for example, someone may remember cognitively what happened to them, but not have any emotion about it. They could be talking about it as though they're talking about the weather. Mm-hmm. And probably we've all heard people like that. Or they may have behavior that is, maybe avoiding certain situations or people, and not know why they're avoiding those situations, but it's actually trying to avoid trauma triggers, even if they're not aware of that. Or they will experience severe anxiety or fear or guilt or shame kind of out of the blue and not have any idea where that's coming from, when in reality it's connected to some specific trauma incidents that have been compartmentalized, that have been dissociated. So part of does that make sense so far?
It does, and I guess when you say dissociated or compartmentalized, are we talking about the subconscious? Like this gets stored into the subconscious, but they don't even know that it's happening, and then some incident brings it to the forefront and it's almost like it becomes conscious awareness?
Yeah.
Okay.
Yeah. It's some people talk about repression. That was a favorite word of Freud.
Right.
But I see dissociation as a little bit kind of almost easier to understand. It's almost a little bit more like shutting, if you have a house, it's almost like shutting something off in a room of that house.
Yep.
It doesn't mean that it's buried really deeply, but it means that, if you have like a storage closet or something that you never go into, after a while, you can even kind of forget the closet's there, right?
Right.
But to access it can be relatively easy. It's just a matter of opening the door,
Exactly.
finding the key to unlock it and open it. And I think that's what happens with the trauma processing. The phase 2 part is when something has been dissociated, compartmentalized, stored away in that closet or that room. It's a matter of kind of going, I know I put stuff there in that closet or that room. Do I really want to look at it?
Yeah.
I've done okay just leaving things there, but all of a sudden it's like the door's bursting open and things are beginning to pile out into the hall and I'm tripping over them.
Right. Well, and interestingly enough, I just want to bring this to a very practical level. I was just recently in a conversation with a guy who horribly abused as a child by his father. Horribly abused. He didn't go into detail, but he just was sharing, and he in his world, he's grown adult, has a family, and he's just shut the door on that and is living life like it never happened. And yet when we got into this conversation, his wife was there, all of a sudden what started to leak out was, there's been these incidences along the way where anger, and like we're talking like big anger, has flared up, and it's and he's like, I know I need to deal with it, but I'm just too scared to deal with it because of what had happened during that time. And so I'm thinking about him and processing that, and he's closed the door on it. And in his mind, I think he thinks, I can keep a lid on this, and I've got it handled. But his wife kind of has a different story to that.
And that's a pretty typical kind of thing to happen. Who in their right mind wants to look?
Right.
Wants to open that door?
Exactly.
I wouldn't want to if I had any other choice. And so it makes sense that people choose to keep that door closed and either consciously, kind of going, I'm not going to see a therapist, or I'm not going to, I'm just going to push away what's there, or unconsciously by, actually having amnesia, so you don't even know anymore what's happened, even though it has. But the thing is, just like this man that you talked about, is these symptoms leak out. They can stay behind closed doors for a period of time. But the man you were talking to, for example, he may be fine the majority of the time, but what if he gets so angry sometime that he murders someone, or that he abuses his children? And he may be an ideal father the rest of the time, but it only takes one incident to kill or really hurt someone.
Right.
So that's where, or assault somebody, or have a flashback and turn around and, punch someone, really severely hurt them. So these times when it does burst out can be really dangerous.
Yeah. And I don't know if you can answer this, but in terms of the phase 2, the processing of the trauma, is that years we're talking about, or is that months, weeks? How long does this process drag out? Because I think that was one of his questions. Like, well, even if I was to start to seek out help on this, would this be years of, having to open the lid on something that's so painful and that's so much he doesn't want to have to go back to? What's your experience with that? And I don't know. Obviously, it probably varies in terms of severity of the trauma.
Well, again, if we're talking about trauma as an adult, kind of single incident or a couple of times, no, we're not talking about long-term counseling necessarily at all. Sometimes a couple of sessions, a few months, again, depending on the impact, but that can be potentially enough.
Right.
But, if someone's trauma has been ongoing, for 18 years, one really can't expect that that's going to be fixed in 2 months.
Yeah. Right.
And so what I would tell, the man that you were talking to is, look, if the damage happened over 2 decades, then what makes it so difficult to think about taking 5 years, if that's what it took, or even longer, 7 years, out of your entire lifespan, so that the rest of the decades of your life you could live free, not having to deal with this. So when you put it in the perspective of how long the abuse lasted, how chronic the trauma was, and you take it in light of a person's entire lifespan, then I think it feels more manageable.
Right. So let's go to the final phase, which is, well, I'll let you explain what the final phase is of your book.
What do I call it? What did I call it?
Consolidation and resolution.
Thank you.
Yes.
Consolidation and resolution. Basically, after all of the trauma memories have been processed, someone's not ready to just kind of go back into life as usual, because they have to find new ways of interacting with people, of dealing with the reality of what they found out. Who are they now in light of the trauma they've processed? Someone who had blocked their memories, say, of abuse, they may have told everyone that they had an ideal childhood and an amazing family, and now they found out that their stepfather, sexually abused them for years, or that a stepmother, physically or emotionally tortured them for years. Mm-hmm. How then do they deal with that family now, both in terms of family get-togethers and how they think about their past? Mm-hmm. How do they, if they used dissociation, if they just kind of tried to deny that anything was going on, how do they now deal with regular life stresses? If they used to just kind of push everything away and now they realize, well, that's not very healthy. I need to find new ways of dealing with stresses and conflicts in relationships. Need to learn how to do that.
Right.
And
so is this always done in the context of counseling? I mean, is that really the only way? Well, let's just start with complex traumatic stress disorder.
No. Not everyone has to have counseling.
Okay.
But I think that it depends on the level of healing that someone thinks is enough.
Right.
I think a lot of healing can happen through healthy relationships. So, for example, if one has really close friends or has family members that have been able to be there and support someone, that can go a long way to healing some of the damage that's been done relationally. Mm-hmm. However, there aren't many family members or many friends that are really capable of listening to the detailed horrors that happen to someone.
Yeah.
I'm not even sure I'd really recommend that.
Right.
So that's where I think counseling can be really helpful. Now, again, of course, not everyone has to go to counseling, but it kind of depends on the impact of the symptoms.
Okay. So, and just want to make sure we don't lose sight of this. When you talk about the process of dealing with the trauma, for someone who's kind of on the side, maybe a listener who knows that this has happened, like my friend who doesn't want to open the lid, what would you tell them is kind of what are they going to get, or what are they going to experience when they start processing the trauma?
Well, it's not going to be easy.
Okay.
Phase 2 isn't easy, But one of the things
that I reliving all the past. I mean, is that what we can tell them? Is they're literally going to relive the torture or the trauma that they've gone through?
Okay, there's an aspect of that. There's an aspect of re-experiencing. That's the part that's not so great. Okay. But it doesn't. But the difference is that they're not actually there now. And if they found, say, in the context of counseling, it's important to find a counselor who knows how to work with trauma. And if someone's a complex trauma survivor, that they know how to work with complex trauma. Because frankly, a lot of therapists don't know how to do that. So that would be one of the first things you need to find out is, does the person that I'm seeking out for help really know what they're doing? Now, if someone knows what they're doing, then they will be able to make that process safer.
And how would you know that? I mean, is that do you have a list of, is there a website someone goes to determine if they're competent in dealing with complex trauma?
Unfortunately, there's no kind of one place.
Okay.
One of the places that I trust more than some others is it's a Trauma Society, the International Society for the Study of Trauma and Dissociation.
Okay.
ISSTD.
All right.
Now that's for more, especially for complex trauma.
Yeah.
They have referral lists for therapists, and anyone that's on that list will kind of understand the complexities, especially of phase 2
Okay.
work.
Okay.
Now, there may be other, if someone's dealing with PTSD that's more adult onset, then there'd be other lists of resources. I mean, probably anyone on that list could also
Right.
deal with
Right.
PTSD.
Yeah.
But what I would do is I would ask someone, I'd interview a potential therapist either on the phone or in person and say, how do you approach trauma work?
Okay. Okay.
Now, if you have PTSD and someone says, I'm trained in EMDR, that's probably a good sign.
Right.
But if someone has a complex trauma history and the only thing the person says is, I do EMDR, then it's like, that's probably not going to be the counselor for you. Then my next question would be, well, have you had specialized training in EMDR with complex trauma patients or clients? And if they go, what's complex trauma? Then you know, then you know that that's not
right there. That's an easy
for
question to ask. Yeah. Okay. I get it.
Well, one of the questions I'd ask, even if you're listening, the viewers don't know exactly what it is I'd ask a potential therapist, do you work with people who dissociate? Because if you're a complex trauma survivor, chances are you use dissociation, you compartmentalize.
Right.
And if the therapist goes, what do you mean dissociate? Then that's probably not going to be the therapist for them.
Yeah, super helpful. Well, I want to quickly, before we wrap up here, I want to go over to the caregiver, because I think we've been talking primarily about the one who's the victim, who's dealing with the trauma. One of the things that we get all the time when we're working with caregivers is this issue of intimacy and how hard it is once the trauma's happened, whether you're talking about PTSD. And I think typically the case we're dealing with is the soldier who's experienced PTSD and they're coming back and they're either heavily medicated to kind of numb the symptoms and the issues. And here's the caregiver who, they didn't sign up for this role, but now they're put into that role to take care of. And a lot of times, I mean, this is a more than full-time job to be the caregiver. And yet what they signed up for was intimacy. They want that, intimate relationship with this person, and they're no longer responsive, or they can't give intimacy. How do they deal with that roadblock in their relationship? And then what would be some tips and suggestions on how to overcome the intimacy blockers?
That's really a difficult situation. If the person who is the complex trauma survivor or the trauma survivor is aware of what's happening, and if they're willing to get help, that is huge. And in some ways I could say, if I were talking to one of these individuals, I'd say, if you're not willing to do it for yourself, would you be willing to do it for your wife or your kids? Because maybe they wouldn't be willing to do it for themselves. But if they actually understand that their whole family is really being impacted, that sometimes can serve as a motivator. If someone isn't willing to get help, like if they're not willing to unnumb, if they're not willing to look at things, I mean, intimacy is about being vulnerable, right? With the other person.
Right.
How can you open up your heart and be vulnerable about other areas if you have this one huge area of your life that is, you can't touch that? Basically what happens is if someone numbs out emotionally, they numb out all emotions, not just the scary ones.
Right.
And that's what the caregiver, I think, is seeing.
Yeah.
Is, they may not even particularly want their partner to talk about the horrors, but they want the good stuff.
Yeah.
They want the love and the care and the sharing. And it's not that the caregiver has to hear about the horrors, but
so what are you saying? Are you saying that the intimacy is controlled by the patient who's needing to go through the trauma work, and there's really nothing the caregiver can do?
Well, I mean, they can work away at it. I mean, I think that one of the things that I'd want to do as a caregiver is to let the person, the trauma victim, help them understand what impact it's having on them. Now, not in a nagging way or not in a, I mean, you can't bash someone's head against the wall or kind of try and, make them go through force. But, you can try different things, but one way is to kind of go, look, I really love you and I care about you. And and right now it's like there's this huge barrier between us. You know, would you consider, working on that barrier even with someone else so that I can get through it?
Yeah. How important, just final question here for the caregiver. This is not a process that's wrapped up in a couple of weeks. It's a long, potentially many, many years. What would you say to them for sustainability reasons? How do they sustain through something like this? Is it self-care? Is it, just basically taking care of themselves? What are some of the things that you've learned along this journey that you could offer to them?
Well, I mean, of course, self-care is huge. I think if someone isn't, getting, well, one person, even another healthy person, can't meet all our needs anyway.
Right.
So having a caregiver make sure that they have other healthy relationships in their life. Now, you have to be careful in an intimate partner relationship that doesn't mean you go out and have a sexual relationship with someone else, because that ultimately isn't going to help intimacy with your partner. Right. But that there are other ways that needs can get met through friendships, through just having a break.
Yeah.
So certainly that is huge.
Yeah.
Continuing to, people take care of the spiritual aspects of themselves in different ways too. And I think that can be very helpful resources for some people, is to, not that there are magic kinds of solutions, but to make sure that they are being spiritually nurtured and nourished in whatever way they find that happening, and whether that's through a personal relationship with God, through a church community or other religious community, whether that's seeking out time in nature, or through music, or through art that kind of feeds them at their deepest kind of levels. I think those things become really important. And I think invitations to the trauma survivor to join in some of those ways can always be offered. Again, you can't make it happen. It can be so frustrating. It's a matter of sometimes a caregiver maybe not giving up on the trauma survivor, but how can they take care of themselves, maybe stay there if they're willing, knowing that there isn't a guarantee unless the individual themselves chooses kind of full life, that chooses to really take a look at it. And some people probably won't be able to do that. They'll